We're really lucky to have Sri join us from NPI, and she's going to be actually presenting building on low-income consumer perspectives and practices to inform healthy retail interventions. And this will be recorded and posted to our website afterwards. If anyone is here or listening that would like to share it with friends. And I'll go ahead and let Sri go forward and introduce herself.
Great. Hi, for those of you who don't know me, I'm Sri. I work as a data analyst here, and as Nikki said, I'll be presenting today a presentation I gave previously at the Childhood Obesity Conference in the summer. So, building on low-income consumer shopping practices and perspectives to further inform healthy retail interventions. So in this presentation, I will first identify some of the barriers low-income consumers face to healthful eating, and then discuss some of the strategies with which low-income consumers try to address and combat those barriers. I will then provide a brief summary of the evidence regarding healthy retail interventions, and finally end with some conclusions and future directions. So the data in this presentation comes from three main sources. The first is the Participant Voices study, which was a qualitative study aimed at understanding the challenges SNAP-Ed-eligible parents face in feeding their families. It consisted of a convenient sample of 55 SNAP-Ed-eligible individuals from 5 counties in California who participated in one of 8 focus groups in 2017. The second data source is the CX3 study, which was an observational study of the food retail environment in a sample of large grocery stores, supermarkets, small markets, and convenience stores located across 44 counties in California that were assessed at one time point between the years of 2011 and 2015. I will also discuss some preliminary findings from a subsample of small markets and convenience stores that actually had data collected at a second time point in either 2016 or 17. And the third data source is a literature review of healthy retail interventions that included studies with pre- and post-test measures and a control or comparison group that looked at outcomes including food purchases, dietary intakes, and/or adiposity outcomes. Papers were identified via PubMed and agency repositories, and the final review included 82 papers published between the years of 1978 and 2016. So jumping right in, the first major takeaway from the Participant Voices study was that SNAP participants really did want to eat healthfully, but often just found that it was too expensive for them to be able to do so. In the words of one participant, "And I try to cook healthy for the utmost, but it's so expensive to cook healthy, so basically I cook what I have." And as another participant said, "But it's so much more expensive if you want to get a good piece of fruit. I mean, this is California. A lot of them grow right here. We shouldn't have that issue buying fresh, delicious fruit. But if you can't afford it, you do have issues." So clearly, price is a barrier that's keenly felt by this population. And to take a further look into this identified barrier of price, I'm going to switch over to some findings from the CX3 study looking at relative price differences. And when I'm talking about relative price differences, what I'm talking about is the difference between the average lowest price for items in stores in low-income neighborhoods and the county average lowest price in supermarkets, expressed as a percent of the county average lowest price in supermarkets. So for example, if you take a look at the leftmost bar in this figure for apples, this is saying that the price of apples in large grocery stores in low-income neighborhoods was 44% higher than the county average supermarket price for apples. And basically across the board, with the one exception of cabbage, for the measured produce items, produce prices in large grocery stores located in low-income neighborhoods were higher. And we see much the same story when we look at produce prices in small markets in low-income neighborhoods. And these produce price differences are actually the greatest in convenience stores in low-income neighborhoods, with prices for 4 out of the 5 measured produce items being over 100% higher. That is more than double the cost. And while we don't actually have the data to look at how produce prices changed over time, we do have information about produce variety, which was inversely associated with produce prices. And produce variety declined over time in our subsample of small markets and convenience stores. And this suggests that produce prices might actually be increasing over time and the issue getting worse. Another somewhat surprising finding from the participant voices study was that participants actually thought of their traditional cultural foods as being unhealthy, and many felt that only fruits, vegetables, and unfamiliar foods such as whole wheat pasta, brown rice, and quinoa were healthy. In the words of one participant, let's look at breakfast, for example. As Latinos, we are used to eating beans, eggs, cheese and cream, chilaquiles, tortillas. So how do we have balanced breakfast? And this really highlights the need for the messaging and programming that's going out and reaching these diverse low-income consumers to really be culturally sensitive. Perhaps providing examples of how you eat healthfully using their traditional foods to avoid breeding these type of misperceptions. The Participant Voices study also found that participants faced both limited and poor quality grocery stores and cheap, convenience, highly promoted, unhealthy options. As one participant said, there's actually 3 grocery stores within those shopping centers, but the quality of the produce is just bad, really bad. With another participant responding, right, also there's with all of the fast food that's around it, that overshadows the grocery store. So these low-income consumers are facing a number of barriers, and the real question is, well, how can they address and overcome those? And we actually found that participants did use various food acquisition strategies to really try and stretch their dollars and food assistance benefits and make them last. These strategies included those such as buying staple and shelf-stable foods, such that the resources they used to acquire those foods did not go to waste because the food went bad before they could eat it. They also used strategies such as shopping at multiple stores to get the best deals, buying foods on sale, and seeking food donations. So things really trying to lower that price point at which they acquire their food and thereby being able to make their limited resources last longer. However, the overarching message talking with these individuals was that even though they used these different strategies and really tried their best to make their resources last, it just was not sufficient to meet their needs adequately. As one participant put it, because when I get my food stamps, I try to stock up every meat, canned goods, vegetables I know go bad within a couple of days, so I try to buy just for that week and save. But even at the end of the month, I'm out. It's just not enough. And on top of this, participants actually said that they were under a lot of stress and they felt feelings of shame and guilt from being unable to provide their children with the quantity and the quality of food they felt they should. In the words of one participant, like when you expect your kids to eat good and they end up not eating good, you feel so bad that day, especially maybe you're supposed to provide for them 3 square meals a day, and you're providing 2 square meals a day, maybe because you couldn't afford to buy the food. I mean, you don't feel good about that. It makes you feel so uncomfortable. So clearly, these low-income consumers are really struggling. It's not only that they can't overcome the barriers on their own, but they're also feeling really bad about it, and it's impacting not only their physical health, but also their mental and emotional well-being. And it really begs the question, well, what can we do? How can we help these individuals? Where do we intervene? How do we intervene? What works when we intervene? And to address these questions, it's first useful to take a look at the shopping patterns of these low-income populations. So according to a report from USDA, using data from the Food Acquisition and Purchasing Survey, we found that low-income consumers save money by buying cheaper, less healthy products than higher-income consumers in almost all retail venues. These are really smart shoppers. They know how to make smart financial decisions and try and get the most bang for their buck. We also know that low-income consumers actually travel to do most of their grocery shopping. While the average SNAP participant lived about 1.9 miles away from the nearest food outlet, they actually tended to travel about 3.3 miles to their primary store for food shopping. And the USDA report speculated that this decision to travel further could be due to various store attributes, such as the price of items there, the quality of items, and the variety of items they could procure. We also know from a report by Spur that, at least in California, the vast majority of CalFresh benefits are redeemed at supermarkets and supercenters. And this really highlights those 2 types of retail outlets as great venues for intervention, because if we intervene in these types of outlets, then we're maximizing the potential reach of our intervention and therefore maximizing the potential impact at a population level of any interventions that go on. And of course, this is all data taken on average across the state. In certain communities, shopping patterns might be different, and in those communities, it makes sense to intervene wherever most of the shopping is going on. Great.
Can I interrupt you?
Sure, go ahead.
Having just been on a WIC call, in that data, do they talk about how many people shop online?
They didn't. This was just using the redemptions data. So if they use their EBT benefits online, it would have just been included in there. But it's not separated out, at least in this one.
I don't think they can use their SNAP benefits. That was a silly question of mine. So.
I think in 2015, there wouldn't have been much.
Yeah.
All right, so now that we know sort of how to decide where to intervene, the next question is, how do we intervene? What works? And our literature review of healthy retail interventions actually found that price interventions were the most consistently effective at improving dietary intake. And when I'm talking about price interventions, I'm talking about interventions such as providing vouchers or coupons for the purchase of healthy food items, providing rebates or price reductions, or any sort of monetary incentive aimed at promoting the purchase of healthful food items. And while at the time we conducted the literature review, there wasn't yet enough evidence regarding the impact of taxing unhealthy foods and beverages, since then, as I'm sure you're all well aware, there's been a lot of work in that area, and that's also been shown to be quite a promising strategy. We also looked at other types of retail interventions, but found that they were not consistently effective. With regards to interventions trying to promote access to healthy food, we found that interventions such as opening new supermarkets actually did not show impacts on dietary intake. And if you recall what I was just saying about the shopping patterns of low-income consumers, they're already traveling further to get to those better deals. So while opening a new supermarket in their neighborhood is great to address the issue of equity, in the sense that do we really have to make them travel further to get those better deals, it's not necessarily going to change their purchasing behavior because they were already spending about the same by traveling further. Scott, you had a question?
Yeah, sure. I don't know. You probably don't have this information, but I'm just thinking about access to vehicles and what do people that don't have cars, what percent of people don't have cars, and what are their strategies? Do they take the bus to a supermarket, or do they buy more locally? Or
That's a great question, and I actually don't have that data, but I think it would be good to look at. Yeah, it would definitely
I
affect
think there was a little bit of data. They get friends with relatives. I think there's a lot of car sharing interventions. Some take buses and stuff, but they come up with various.
people get rides?
There's some, not really data, but there's some comment on that in Susanna's basic needs among student papers that you might take a look at. That was one of the 3 or 4 additional stresses or challenges in students finding affordable transportation.
And we will share that report with you guys yet. It's just not done yet. We're still working on it.
We are.
But for student food insecurity, you remember how we've been doing a lot of work on that, and what Suzanne and I did were some focus groups with students to see what their barriers were with housing. So what Ken's referring to is that a lot of them said, well, I have to move further away from campus to find affordable housing, and then as a result, sometimes I'm further away from food, and sometimes I'm further away from the campus, so then I have to buy my food on campus, but the cheapest food is the least healthy. Anyways, they get into this vicious circle where they're trying to afford housing, and they make all these rational decisions, and then it contributes to
I remember when similar findings came up a couple of years ago on our literature reviews that we were doing, and I was so excited by it in 2 respects. One, it seemed to me it kind of blew up food deserts, and number 2, it does something to undermine some of the work on corner stores, I think, and because the 5%, I think, of the purchases on the previous slide were there. I mean, some of the stuff that comes out of there is slop, but it's not a lot of slop, as compared to what people are buying in supermarkets. And I've always felt that the emphasis on corner stores was very misplaced, although people have had very long and happy careers working on corner stores. I will be quiet. I love this stuff. It's just great.
That's interesting. Okay, so we also took a look at interventions that provided free produce deliveries to households and communities, but found that while it did show some promise at increasing produce intake, there really was insufficient evidence to draw any firm conclusions about it. We also looked at a variety of store-based interventions, such as those providing print materials, running media campaigns, providing in-store audiovisual nutrition education, or changing the product placement within stores, and those that were multi-component and did all of those types of things. And we really found that the evidence was mixed with regards to these types of interventions with regards to the purchasing outcomes, and that there really wasn't enough evidence with regards to their impacts on dietary intake and adiposity outcomes to draw any sort of conclusions there. So, in conclusion, we found that economically disadvantaged consumers face multiple barriers to healthy eating, and we recommend that price interventions be implemented wherever possible, as they were the most consistently effective type of intervention. We also recommend carefully considering intervention reach when prioritizing efforts and trying to maximize that. And we finally note that additional research is still needed to inform evidence-based retail shopping interventions, perhaps looking at strategies such as limiting access to unhealthy foods in retail venues, or understanding the impact of in-store interventions on those dietary and weight-related outcomes. And finally, it's just really important to note that we still have more work to do in really promoting our understanding on how best to provide communities with access to affordable, high-quality, and appealing produce items in ways that really do support the businesses and the residents of those communities. These low-income populations are really struggling. They're faced with all these barriers. They're trying their best to overcome them, but their efforts alone aren't fully adequate to meet their needs. And their physical health is being detrimentally impacted. Their mental and emotional health is being negatively affected. And especially in California, where we have such high housing costs in many parts of the state, the financial burden these low-income individuals are under is extremely high. So it's really important that we do continue this work and really try to understand how best to help them. And these are my references, and I just want to say thank you and acknowledge all the great members of the project teams who worked on these projects, as well as the staff and, of course, study participants for all of their support of and contributions to this work. And thank you to all of you for listening.
Have you found any studies of looking at opening grocery stores in neighborhoods while combining that with price, like interventions around price? Because it's an economic thing. I'm wondering if you narrow the distance and lower price, what would that do? Anything or any interventions that have done both?
I don't know about any interventions I've done both. I would think that that would actually be really good because it's addressing both the equity and the price, which is really driving their behaviors.
This is kind of a question out to my colleagues here, but it strikes me that maybe, if there's evidence for this, we should maybe always be saying, if these purchases are super price sensitive, then our whole national food policy that subsidizes unhealthy foods would be a great intervention for all communities, not just low-income communities. But can I say that?
We might agree with you. And I think that's exactly right, because while we see that lower income families, because of all the barriers that you so eloquently pointed out, Sri, tend to have a lower diet quality. The average diet quality of the U.S. population is an F, a D or an F. Yeah. So even people that have adequate resources for whom money is not the limiting factor don't eat very well. So.
Right. And isn't it true that we are changing the price sort of calculations at a federal level by what we subsidize the food system? like subsidizing corn and soy, basically.
Economic literature on
Yeah.
that.
Out of here.
There are debates among economists that
About whether that
and for
is
sugar,
true
for
for price.
example, like we make sugar more expensive rather than sugar, so the corn is a little bit different, but there are economists who argue both sides of that.
But
Bummer.
that doesn't mean we couldn't add additional subsidies to make it in favor of healthy food.
Well, and Norway, there was like a news
Yeah.
article this week about Norway, like Norway, in,
44%.
yeah, like they very much changed
Oh,
like
yeah,
sugar
the
intake
sugar,
by
yeah.
increasing the price of sugar. So I mean, yeah. So
There's
there's
still like
definitely,
an
there's
argument.
clearly
Yeah.
interventions to do to change price. I'm just saying that the subsidies.
Oh, that's why I put it out there.
Yeah.
I think it's interesting talking to, one of the economists here actually at Berkeley. I think there is a big issue though of, supply. What he explained is that once that there is an issue with overproduction of certain things in this country, which is driven by many factors. It's just, I think economists don't like when you simplify it just to the federal subsidies. That's actually a small piece of what's driving the supply. So it's funny, I'm cleaning through my files, everyone knows, and I was looking at some of the dietary trends, and I was just really struck by, this plummeting in milk consumption and this incredible corollary rise in cheese production. And the way this economist would define that is like, if you produce the milk from the cows, it's going to go into the market somewhere. Like they don't take the fat out of the milk and throw it away. So, if people drink less milk, then they're going to promote cheese. Cheese gets cheaper. Then all the manufacturers put cheese into everything because it's so cheap. So even I'm simplifying it, I'm sure, but there's a lot of things in our system driving this production of certain commodities, and they find their way into the food system nationally and internationally. So I think that production is a big factor, but it's not a simple just get rid of subsidies for wheat and corn and we'd all be okay.
When we got to the figure on variety dropping, you mentioned that you would expect price to also go up. What was the connection between that?
So we found that produce prices and produce variety in stores were inversely related with each other. So as the produce variety goes up, the price tends to go down. So if produce variety is going down over time, you might expect to see produce prices going up over time.
And to follow up on that, was
Yeah.
that primarily just their capacity to store more
I
produce?
can't hear you.
Was it because of their capacity to store more produce? If there's increased produce variety, it's likely you might have a larger selection of fruits and vegetables requiring refrigeration.
I'm not sure about that. Wendy, did you look at that?
Well, we didn't have that kind of information, right? It's just observations of a large sample of stores. So it's just what they carry. So we could model, we had their price and we had the variety, but we don't know all of the characteristics that are driving that.
On your second conclusion that incentives help, did anyone look at what happens after the incentives stop?
That is a good question. And I think that if you stop the incentives, and this is just me speculating, but then you no longer are helping them address the barrier of price and it returns.
There actually was some evidence of that. It doesn't have a permanent effect, like on preferences or something. It goes back up as soon as
And what the hell's the point of them?
well, they have to be permanent.
Yeah, but if they're not, what's the point to it?
Yeah.
Well, the point is you're trying it. It's not like a pilot.
No, if she's got the evidence that it doesn't work, why keep trying it?
We have the evidence it works. It just has to keep going. It just has to keep going.
You just have to reduce the price and keep it reduced.
Yes.
There are no other questions. I actually have a question for all of you. So we were considering whether or not it would be a good idea to write a commentary piece on this information in the presentation, and I'd love to hear your thoughts on whether you think we should or not, and if you do think we should, if there are journals you think would be good fits.
Well, part of my plan for asking you to present this is because I think, at the very least, this should be the topic of one of MPI's news briefs. because it's perfect for that. And our target audience for that news brief, which is cooperative extension, but beyond, they all work with this population, and so I think they would really value this information. But I also like the idea of a journal commentary. They're just harder to, we have control over our newsletter. The commentaries are harder to generate interest in.
I think it's very dangerous. Because it casts doubt on corner stores, on the incentive programs, on putting new markets into low-income neighborhoods. And honestly, there's a lot of investment in those three things, from USDA, from foundations, from advocates. I tend to love it, but I think it's very dangerous.
So I think we can frame it right, Ken. We wouldn't say, don't do anything at corner stores. We would just say the bigger bang for your buck would be at markets where people shop more. I think we can frame it.
And then incentives would have to be permanent, so
Yeah.
USDA should make its incentives permanent and widespread.
And
Maybe
we should
invest
think
less in
about-
some of those other things.
And we should think about price and how we can change the food supply and the price of the food supply.
Why don't you do a paper first?
Do a who?
A paper,
These,
qualitative.
They're all individual papers, right?
yes, these are individual papers, and this is just bringing their results together.
Okay, so these are all published.
Except for the lit review, has not been published in a journal. It's just available on our website, I think, and it wasn't published in a journal.
Is it on our website?
It is.
Oh, good.
Well, then I tend to agree with Ken, probably not a commentary in a journal. They're already published, or at least two of them are. I do disagree with Ken a little bit about avoiding confronting the vast corner store invested advocates, because I do think we should be expressing a voice about where people are shopping, and it's not about small markets, it's about big markets, and what can we do there?
Well, and it's
Very different, yeah.
I imagine if corner markets would get their prices down, people would be first.
I'll push back on that a little bit, because it's like, we are interested in health outcomes, but there are other reasons that people are interested in improving corner stores. So for us, the definition of what the outcome is very tight, but that may not be true for groups that are doing corner store work.
I completely agree with you. And so I think there's a difference between the right to food and healthy food access and all of those things. But then price needs to be a bigger part of that conversation. So right now, that conversation, I think, inadequately deals with the price challenge. And so a lot of the interventions are sort of price insensitive. And so the idea that you would have all these foundations pouring money into getting some apples that cost $2 each into a corner store in a low-income area, that's probably not worth that investment.
Yeah.
But doing it in such a way that you provide true access, because we talk about access as too often physical access, and it doesn't include true access to people who might live there and benefit from having real access to healthier food. So I think the conversations need to evolve.
Well, I do agree that there's other things about corner stores that are worth thinking about investing in. It could be alcohol, unhealthy snacks, food access. I mean, there's just other things that corner markets provide than fresh produce access. But, oh my gosh, we've been at this for so long. I don't ever see very inexpensive, good variety, good condition produce ever doing well out of a corner market, and Gail can say why, because she studied this. In the heel stores, I mean, you just don't see it.
Well, it's almost a by definition, right? So I know Wendy and I were talking after. If it stays a corner store, it's mainly access to junk food and often alcohol. Kind of by definition, if they do a complete conversion, then it's becomes something else. And complete conversions probably work as long as they can keep price down, but I think there's a problem with, and people love them in the communities, The problem is they can't sustain themselves financially, usually because they're not doing enough volume. They don't have the advantages of market share. So, I think these are important. I think they're important to put forth for this discussion we're having right here. We shouldn't come out like we're out to get corner store interventions. It's just to say honestly what is working and not working about corner store interventions. And I've often had the fear that what if people just put a few apples and bananas and then they're promoting that corner store, and otherwise that they were going to a healthier grocery store, and now they start going to the corner store and they're exposed to even more junk food. I think, people have done good work and have been struggling to really, everyone who does this work has the best of intentions, but every once in a while we have to step back and reflect and say, how do we move forward? What should we really be lobbying for here? How are we really going to affect access? And I think there's a lot of good local interventions. Janet, who was on the, I was on the panel. It was Janet's presentation I did at AKJ. It was me. That was the fourth talk. I was on autopilot. But, it was some fantastic presentations of local work, and the common thing was people loved them, and actually people were buying a lot of stuff, and it was really fruit and vegetable access. It was really making a difference in that, but the question was, none of them were financially sustainable. So how do we make that happen? Is it through subsidies? Is that a better investment of government funds than like a lot of education, for example? Or how do we allocate those funds reasonably? So I think we need to pose questions and not be overly judgmental, but be provocative. I think it's good to incentivize the discussion, to stimulate discussion.
There's a fair amount of good stuff by FRAC, or collected by FRAC, on the adequacy of SNAP benefits. And looking at the ability of low-income people to purchase a healthy diet obviously gets quickly into SNAP. So I think we ought to be mindful of the implications of this for SNAP. And, there are always people out there wanting to get rid of SNAP or lower the benefits or do all kinds of nasty things. But I think the best evidence is that the SNAP benefits are helpful, but not adequate. And so it would be wonderful to have some interplay or at least reference to that literature.
Yeah, something I was thinking about both in your presentation and now is the implications of this for nutrition education. So what does this mean in terms of, one, if people want to eat healthfully, it's not that they don't know how to eat healthfully, but with this price. And two, I had never heard that people were coming away with this idea that their cultural foods are bad. Like, is it implicit bias in the education we're providing? Like, what is that? How do we change that? Because that just
Yeah, I agree. Yeah. And WIC certainly has done, I think, a pretty good job of addressing that. I mean, there's beans in the food package, there's cheese, there's eggs. What was the other thing they had? Tortillas. Everything almost, and then they can buy fruits and vegetables that they wish. So I feel like it's more of a broader cultural conversation and like what you hear in the media about what's going on. But we have, I mean, there's SNAP Ed, so, what's the
Healthy living.
So there's there must be a role for that. So so just if you have any thoughts, certainly.
Yeah, definitely. I mean, as far as I can think, it's just really like whenever we're giving examples of what is a healthy diet, for example, it's like maybe tailoring it to the cultural diets and really saying like, this is healthy, because it might be that they see a certain type of food presented in all the materials they're getting, so they think, oh, this is healthy, what I'm eating, it's not in here, so it's not healthy. So really just trying to include that, and it's difficult, right? There's so many different minority communities, in California especially, and so trying to tailor to each community is a difficult task, but I think that it's an important one, because otherwise, if you don't see what you're eating traditionally in there, how do you necessarily know that what you're eating is healthy?
It does go also beyond that, where when you start talking to people, for example, about whole grains, and you start introducing people to quinoa and, like, brown rice pasta, they believe that that's the only way to eat healthy, and that all of that, so a corn tortilla is now bad. And we did write a report for CDPH about implications for SNAP-Ed, not that I'm sure anybody that anything happened with that, but I agree with you, like, that also was, like, heart-wrenching to me to hear these people talking about things that way, and it is partly from media, like what people see on Facebook and all this, like, you know, the way we talk about healthy foods, like you have to eat quinoa and ancient grains, and that's the only way to eat healthfully, and people actually internalize that. But also there are messages they do get from nutrition education programs about, like, you know, you should eat particular types of whole grains, and like you're saying, if the whole grains that you eat are not included, suddenly those are bad. You're like, you're substituting, like, this is crazy. And so we are giving some of the wrong messages in our nutrition education programs also.
Can I just say one thing to push back a little bit on that? And that may be true, although I don't think we have the evidence for that, and I just threw away all of 20 years ago, had no materials in Chinese, and all was on fruits and vegetables and whole grains that were specific to those cultures. Oh, geez, maybe I should go dumpster diving. And this is just anecdotal, so this is not evidence. I've never seen an analysis, you know, of the nutrition education, how much is this culturally relevant. I just know from WIC, they spend a lot of time trying to do that. But from anecdotal conversations that I've had with people, particularly immigrant populations with kids, they want to, they feel some pressure to eat the American way. So yes, a kid could come with their traditional foods packed in their lunch, and then they look around and they see everybody with packages of this and that and this and that they brought from home, and it's a peer thing. And it's also, I think, and this is just anecdotal too, we'd have to do an analysis of this, but what you see on television, what the advertising is I think I would guess it's more due to the advertising and not due to the fact that nutrition education hasn't been culturally tailored enough. Because having been doing this for 30 years.
I don't know what quotes you shared. For example, there was a passage about, like, I eat chilaquiles and beans and cheese for breakfast. I mean, so that's that doesn't fit into the nutrition education model of what you would eat for breakfast, and that is directly what people were referring to, and there were a few passages like that, where it's like,
but where are they getting that from?
Promoting low fat for a long time. People think, like, oh, if I eat these things that are whole, healthy foods, but maybe aren't low fat, that is somehow bad. So I think it's a both and.
Yes,
it's not an either or, but it is happening. And it is what we heard. That is specifically what we heard.
Right. I'm saying from people that I know that have never had any SNAP education, they still look at television and the media, and that's what they think they're supposed to eat. Nothing to do with, you know, SNAP-Ed or WIC being tailored in a certain way.
I'd be interested to see, because I haven't spent a lot of time, like, looking through all the USDA MyPlate resources, but it seems very generic, like, what a quintessential healthy American plate would look like. For instance, it's like, you know, your half vegetables, a protein, and, like, chilaquiles doesn't have that. But I remember in grad school we talked a lot about, like, epidemiology with Latino communities, and one of those things being, like, when you're doing food frequency questionnaires and having them tailored to different cultures, because things like sofritos, when you cook, you put, you know, onion and tomato, that's not registered as a vegetable. So, like, things like that, and yeah, so I don't know.
I feel like part of it is having nutrition educators that are also more understanding of those populations, so they can bring in their own knowledge or their own experiences where the materials may not cover it in that detail, and that can help address, I feel like, some of that. But I agree with Hallie. I mean, that was like, when I read the Participant Voices paper, I mean, that really stuck out to me too. Yeah.
I think it's interesting also to think about the need to both diversify all our positive examples, but we also have been restricted by some of our funding from talking about what you shouldn't do. Like, you're allowed to promote things, but you're not allowed to denigrate other things. And really, really what we need to be saying is absolutely cook what you made, make it home. Basically, if you do that and never go to a fast food restaurant, it'd be so much better than any little increase in apples or something we can get out of all our nutrition education stuff. But we're not supposed to talk about that.
I guess the other issue that, I don't know if it came up in participant voices, is, the kind of poverty of time issue.
Yeah.
And, I mean, that's clearly such an issue. And it ties in with food waste, the quote about vegetables, not lasting very long. And, it takes more time to cook with fruits and vegetables especially. And I'm just kind of wondering, to what extent did that come up? Any thoughts about how that could be addressed, or these kind of like cut up veggies that you get at Trader Joe's? Do they make a difference now? Is that something that we should be promoted?
They cost
But they're more expensive, exactly.
I'll defer to Auntie.
It definitely came up, yes, and we talked about it in the paper. So, and the thing that came up most strongly, I mean, for me, that resonated was the dual poverty. So people who are working at very low wages have a poverty of both income and time, and that's particularly challenging. And that a lot of the strategies people with more financial resources can employ, people with fewer can't. And then there was a lot, I don't know if you talked about this, but there were also some very compelling passages about the guilt people felt. So it's like, I'm strained for time, and then I have to give my kids some kind of cheap, unhealthy food, and that was like very problematic. So it's absolutely, so how do you do that moving forward? Well, you can't have people working so much for so little money that they can't afford to buy healthy food. That clearly doesn't work. But also maybe there are some other models for how we think about feeding and eating that are a little bit different than this idea that everyone has to be cooking at home all the time, because maybe that doesn't work so well if everyone's expected to also have full-time jobs.
Yeah. I mean, I think the other thing too is that people, I think a lot of people have in their head that canned and frozen is not as good as fresh, and so, they don't use, I mean, it'd be very easy to open up a can of string beans or, whatever, but.
Cooking methods is a lot of work around that, like educating, frozen.
That it's
That it will
encouraging that.
sometimes be more nutritious.
Right.
I think it's always going to be a problem, and I don't want there to be a misconception of this, the media has a big effect, but we didn't evaluate media, and the marketing tactics of supermarkets have a big effect. And that's something we couldn't do, but you have to remember that with our limited resources on the public health and nutrition side, we can never counteract the media and the marketing tactics. We will never have their budgets. So that really we have to talk about controlling that rather than trying to out-educate it. I personally feel like the errors in our nutrition education, sure, we've made mistakes, but I do not think that nutrition education or the My Plate or the pyramid are the cause of any of this. That causes force is much bigger than that. It's just that no longer is that how people are mainly getting their nutrition education. They get almost all of it from the media. They're inundated with it, and that is a huge impact that just cannot be overlooked. But we're not going to outdo them with our little bit of nutrition education we do. It's just really, really hard. Or at least that has to be complemented by some food systems, big food systems things. And also before we close, I just wanted to acknowledge that SNAP-Ed, USDA SNAP-Ed funded all of these studies. So as much as they may put limits on us, I am very thankful that they have funded the studies. We may not be having this dialogue if they hadn't funded it, and they're under so much attack these days. I want to give them some congratulations for allowing us to do this work and funding this work. And
I think one of the strongest things that you showed there was the distribution of purchasing patterns by store type. I mean, 80% are supermarkets and superstores, probably of no surprise to anybody in this room, but that's important data to share for the conversation we were having earlier about where we focus our attention in the small settings of value, but if we want to affect population level change, we're never going to get there without holding it in our minds that this is what we've shot and finding ways to overcome the transportation difficulties to do so. and it sheds light on our concept of food deserts, and they are hard to work with, deal with, for what Gail just said, but that's really my point. That's where it's at, and that's where the pattern, that's what they're doing. So let's shift our effort to focus on that.
Gail, with CDPH, assuming we can all agree, and we haven't quite yet, but I think if we frame it right, we can agree a commentary is probably of value. Would CDPH have objections to that? Would that get us into any hot water? Not that we shouldn't do it, because it would, but
I don't, for one thing, I don't think they would opine on it unless we were doing it on SNAP-Ed funded time. But because we can take the results of the studies and interpret them however we want. But I don't think CDPH actually would object anyway, because they actually changed their focus. They decreased their focus on corner store work based on this, so they don't have any problem with it.
I wasn't talking so much about the corner store thing, although and it may be because you guys have been presenting it for a while that it felt to me like old news, but the talk about the some of the other points that you were making, Shri, about price being so critical, about having to tell people what not to eat, and your point, not just what to eat, and shifting some of those purchases, the conversation about time as a resource and how we fail to consider that. Some of those bigger picture things that have come out of this work was what I was thinking might go in the commentary, but maybe you and Wendy were thinking something totally different.
I don't think any of those would be hot button issues. I wouldn't get into criticizing SNAP, but in California. But as long as their programs aren't, I don't think they'd have any problem with us talking about what's effective intervention. And again, if it was just a commentary for MPI and it was not acknowledgement of SNAP-Ed funding, so it wouldn't really.
No, I was not talking about the MPI newsletter, but if you were submitting it to a journal.
Oh, yeah.
Somebody who's much smarter than I am, I can't remember who the heck it was,
Gail?
suggested looking at lowering the numbers of corner stores to see whether if you had fewer corner stores in the cities, I guess, not out in the boonies, but if you had fewer corner stores, would you get enough volume to be able to increase healthy foods? I mean, part of the problem is that you don't get a lot of volume and people come in for a pack of cigarettes and leave, but if you had enough of folks coming in, would you be able to kick up the quality of the stuff?
Yeah, and people have been proposing that we have to, for years now, we have to, there's a lot of evidence suggesting that limiting access to unhealthy food and increasing prices on healthy food could be a very effective intervention, but it's not been a very acceptable intervention for various reasons. And we have recommended now for years zoning, because you can actually zone out those kind of places in your local community if you want. That's one of the few local interventions you can actually do. You can zone the types of commercial retail. Why do you think there aren't a lot of corner stores and McDonald's in wealthy neighborhoods? Because they have a lot more, they have a louder voice in local politics, and you won't find a Target in Piedmont.
People are advocating that. Gail, have you seen either policy or advocacy or anything that goes in that direction?
I have not.
There was
It's
a
been
zoning ordinance in LA for a while that tried, maybe it was
Right, trying to get rid of fast food.
They fast food and
Yep, I remember that, but it died.
they weren't successful,
Right.
for different reasons than what I think was reported, but anyway, I think there weren't enough new things. It didn't really change over the time period that they had it in place. That's the other thing, these are such long-term changes, because by the time you get the language passed in a local ordinance, you have to wait 25 years until, the stores turn over, because you're not going to start switching stores out. And the other challenge with that is I think you'd have to couple that with saying foods and beverages cannot be sold in any of these other types of retailers. Because, of course, now, it doesn't matter if you have a corner store or not. The drugs that every other store sells, soda and candy and chips, and, so it doesn't really necessarily matter now in the current environment, whether it's a corner store or not. Those products are so everywhere.
That's what
So
I
you
was
have to
gonna
also
say,
zone,
too.
Yeah.
make
Like,
that
it'd be interesting
not
to do a study and see what the density around the average person's house is of access to junk. Because,
Some of those studies, I think, have been done.
have they done?
Yeah.
In Alameda, we did try for a while to
Because you
get,
can get junk at grocery stores, so you'd have
Oh,
to
yeah.
calculate everything.
we were trying to get an
I mean,
ordinance
farmers
just to
market.
stop the ice cream trucks from lining up outside the elementary school as they get out every day, which they do. And then the dream was to move from that on to not having corner stores across the street from elementary schools, because I actually think, there's a difference in elementary and middle school, certainly, about they're literally right across from the school on your way. Kids are having breakfast there on their way to school, but if they were 5 blocks away, it would actually make a difference.
they'd at least have to burn a few calories walking.
Right, or not be able to run over there quite, so anyway, but we got absolutely nowhere with the city.
So, it might be the economic incentive
Right,
for
exactly.
for the retailers that would be a factor. That's why taxes have been so effective, or what they did in Norway. So actually everything, all commercial behavior is driven by money, right?
Right,
So,
well, and at the city level, they were like the tax income from these stores.
yeah. So those might be quicker than zoning.
But the other thing to think about in terms of like that particular question is people in rural areas. Now we actually are having more disparities of diet, I think, in rural areas than urban. So even though urban areas, you're flooded with all these things, these people do live in these areas without much access to food, and people's diets aren't better. So it's not necessarily just there's something that happens, but there's also a lot more happening that's driving that.
But there's also a lot of places out, I can testify now, in rural parts of Southern California where there is no grocery store, but like the Del Taco.
And then there's the school policies. I think I shared this with you guys before. I was at a school recently where they just passed the policy that kids couldn't order food deliveries because they didn't have a lot of fast food near the school, and it's a low-income school too. And then but at lunchtime there were all these, I forget the names of the companies, Uber Eats and Grubhub, yeah, delivering, McDonald's to the kids.
I love it.
Yeah. Well, SFUSD has complained to us about that too, that the kids in the San Francisco Unified School District, a lot of them will have those deliveries made, so they might, zoning might help a little, but there's other things to think about too.
Yeah.
This is a little off of our topic, but it relates to some issues people have brought up, and I'm curious to know if I'm just the only one in the room who hasn't heard about this, but Carolyn Kurtz at CDPH last week was talking about some journal supplement article she's doing, thinking about the idea of industry determinants of health. And I thought that was really interesting and exciting, and certainly ties into some of the issues that we brought up today, and I'm eager to see what they have to say about it. And I'm glad to see that everyone in the room already didn't hear about this, except for me.
That's great.
Yeah, can you send us some information about it?
Well, now I know everything I've told you, but we should keep an eye out for Carolyn Kurtz.
So maybe CDPH won't even not object. They'll
Yeah,
co-author
yeah.
it.
Yeah, because we could support their conclusions if we're saying, you have to change price and access. You can't just, add a few corner markets with a banana, all the things we've been talking about.
Well, I could write to her and ask her what journal and when or something, unless, Gail, you probably talked to her.
Or Gail, maybe you want to say we're thinking about a commentary based on these studies and the literature review, and we've heard that you're also looking at talking about the role of industry and health or something.
Well, you can certainly name me. I mean, she and I were having this conversation, but Laura, you were there, right?
Is it
When
1
she was
o'clock?
talking about that?
So it's just about a minute to 1 o'clock. So
We
if you
have
been like a really
our fearless leader is giving us what did she call it?
Time.
No, town hall, thank you, whoever said that. Not this
So
fearless
thank you
leader. I'm very
everyone
fearful.
for all of your
Our other
comments.
fearless leader.
If anyone else wants to stick around, we can still have some more conversation, and everyone's welcome to leave as well if you have other
And Water First had a little celebration coin, and I did not want to take those brownies home, so if people would like to come and partake, I would be most appreciative.
Plenty of apples.
I brought the sauce. Those are really low. That is
Presentation, thank you.
Oh, my God.
Take 5 minutes.
I've never, but I mean, it's
Right.
exactly, but it's garage that we